All right, thank you. So my topic today is feasibility and acceptability of a novel gamified mobile solution, incentivizing medication adherence for youth with HIV. And I'll be presenting on behalf of my team. So just an overview of HIV in Nigeria. So we know that Nigeria is the most populous country in Africa with 1.9 million people living with HIV. It also ranks, the fourth with the largest global epidemic and has the largest number of perinatally infected children worldwide, of which 10% of young people are living with HIV in Nigeria, and only 33% have achieved viral suppression. And then there was a need for us to look at strategies to improve medication or medication adherence. And then we looked at social norms. So how do we use social norms to nudge behavior? And then in terms of this, we're looking at how feasible it will be, how acceptable and appropriate it will be to use certain social norm strategies like peer relationship, healthy competitions, and financial incentives to nudge adherence. And then we had, that's what gave birth to the Peer Naija app. And it is an app that is downloaded on an Android phone for now. And these are the features. So this is how the app will look like on the phone. You get to choose your avatar after downloading, and then you get to set up your reminder, the time, the regimen you're taking, the time you take your medication, and what dose you take. Also, there's a competition bit where you get to take your drugs, log in, and then you climb the leaderboard. And then you earn achievement. So you have from baby steps to, get perfect runner, and then you have the peer support. And then also you have individual, so private group, and then you have group chats to communicate with peers on the app. So what was this trial designed for? First, we enrolled youth living with HIV between the ages of 15 to 25 years who have been on ART for at least 1 year, and then they own or have access. So own means I have a smartphone, or my parents have a smartphone and I can use their smartphones. And then what were we looking at? It was characterized by daily customized medication reminders, social support, early provider outreach, so getting to adolescents in the health facilities in order to achieve medication adherence and achieve viral suppression. And then monthly data stipend, some incentives was given to each participant at the end, and then when they came to the facility to access care. And then we had the Peer Naija group and then the Peer Naija Plus group. So the Peer Naija group had social incentives, and there was an added advantage of financial incentives, making the Peer Naija Plus group. And then the study was conducted for 24 weeks and at baseline. And what were we measuring for? We're looking at technology usage, depression, stigma, social support, medication efficacy, levels of adherence, feasibility, acceptability, appropriateness, and achieving viral suppression. And then this was the data we found. So majority were males in the study and had at least, majority had secondary school education. The average age was 18.7 years. And the participants had been on medication and assessing treatment, and they had been diagnosed with HIV for at least 12 years. And they had been on dolutegravir, for a while, and 84%. So majority of these participants were on dolutegravir, and they had achieved a patient health score of 18.8. And also some participants had assessed, experienced some level of stigma at some point in time. They also had access to, 71.8 had access to social support, treatment support partners, help from their caregivers, parents, and help from the facilities. Also, they had access to peer support as well. And then there was a level of confidence. 7.8% of the participants were confident in taking their drugs. So there was a high level of medication confidence recorded in the study. And at baseline, 77.7 had, 84% had achieved viral suppression, which, and at the end, we reported that 81.2 had achieved viral suppression. Also, self-reported adherence had improved from baseline to which was recorded at the end of the study. In terms of the implementation outcomes, so we found out that the Peer Naija using the mobile app was feasible, it was acceptable, and it was appropriate. And then we had some representative quotes. So most of these quotes show that they liked reminders. It helped them to remember to take their drugs. It was a good app that reminded them, because we know that lots of youth, over 90% of youth, are engaged on using their phones most of the day, for at least 3 hours daily. So it showed that there was positive impact in using their drugs and having reminders. Also, there were barriers recorded. So they had games which they couldn't download, and then they had some technical issues which were rectified during the study duration. And then in conclusion, the app provides feasible and acceptable approach, which helps to improve adherence. Also, there's a need and there are opportunities to improve feasibility and acceptability, which involves engaging stakeholders and getting feedback from the youths, which we started with, but there's a need to continue it, engaging and optimizing the chat and the notification features. We also noticed most of the adolescents and the youth stated that, having a lottery will be a motivating factor, because it will spur them to want to engage in healthy competition and, improve medication adherence. User-centered design is very important, because without the stakeholders, then we don't have, a sense of direction. And they helped us from the beginning till the end of this pilot study to make sure that it was what they wanted, and we incorporated them. And that was how it was beneficial for us and for them to use as well. There's a growing use of smartphones. However, there's still the need for tech equity, because we found out that a number of people had to drop because they had issues with their phones. We couldn't enroll quite a large number because they didn't have Android phones or they didn't have access to phones. I would like to acknowledge the collaborators, and then Dr. Aima Honkai, who is the PI for this study, from the various institutions. And this is a flowchart of how participants were enrolled. And a number of those, so 5 of the participants exited at some point, then again, because they didn't have smartphones or they had issues with their smartphones. Thank you very much.